Over the next few years, Aligning Forces communities are going to be at the forefront of reform. You're uniquely positioned to be the innovators that others in the country will look to by working together to ensure that the care you deliver and pay for and receive is the high value that you expect.
Collaboration of the community will make all the difference in how successful we are in executing on changes of our healthcare delivery system, overall quality and cost, equity, and transparency of information that's provided to our community.
We launched this initiative to improve healthcare quality, to reduce racial and ethnic disparities, but also to create models that the rest of the country can look for. These locally focused initiatives to us are the most promising paths toward creating better care, starting with places like Buffalo, Western New York, Detroit, Kansas City, Memphis, Seattle, but eventually spreading to the rest of the country.
We can no longer continue to have the silos of physicians talking to physicians, hospitals talking to hospitals, nurses and health plans kind of all at the table but talking to each other. We know that it's much bigger today and that we really need to involve and make it a community effort. We need to have the consumer voice at the table. And very importantly, we need those who use healthcare and pay for healthcare also be at the table.
All of these areas or topics are going to be included in some way in the new health care reform bill. So in many ways we're ahead of the curve. First, the new law emphasizes finding ways to help get patients more actively involved in their own health care, especially if they have chronic conditions like diabetes. Second, the new law speaks of the need to measure that care through different physicians, that different physicians provide and report this information to the community. We've now put all systems in place to publicly report that type of information. And third, the new law talks about helping doctors and hospitals improve the quality of care they provide, and we have a number of programs that are going on right now to do just that. So we have a lot to be proud of, but a lot to build on.
Shine a light on health system performance. Getting more information and transparency is a huge motivator of the provider community to do better. All the research has demonstrated that. And it gives you the information that you and your consumers need to make better choices about providers.
We do have to remember how much we've progressed in the last 5, 6, 7 years that we've been doing this. When I have an opportunity to travel or speak nationally, people are always wowed at what we are doing here, and so I think we can take a lot of pride.
The federal healthcare reform has some different pilots in it to test payment innovations, and those include medical homes, which is one we're working on, payment for episodes of care, and then the idea of accountable care organizations.
As you heard, healthcare delivery is local. And so the solutions for any issues related to healthcare are local. So my charge to you today is to roll up your sleeves on a Saturday morning and help us partner together in improving patient outcomes.
I've been living and working in Washington, D.C., but I feel passionately that real reform does not happen in Washington, D.C., but real reform, true reform, happens in local communities.
If you guys are successful in what you're trying to do here and improve coordinated care, focus on prevention, you do all the things that we talk about in the healthcare business, then you'll kind of lead the way in terms of making our healthcare system better. But you're also change agents because people listen to you. You're members of a community. You're members of a local community. You're members of a state community. You're members of a national community. What you say has relevance.
So even with passage of healthcare reform, let's remember that genuine reform is local. The real work happens here.